Hi, Genevieve.
Hi.
My name is Apriliando and I'll be your nurse practitioner today.
Okay.
So today we're going to be doing history and physical.
Okay.
Before we begin, is it okay if I call you by Genevieve or would you prefer by other name?
Genevieve is fine.
Alright, Genevieve. So before we begin, I'm going to quickly wash my hands.
Okay.
And also I'm going to gather some supplies, okay?
Okay.
So, washing my hands right now. And then I have the reflex hammer tuning for the for this case ophthalmoscope, an otoscope, cotton ball, tongue depressor, and a cup of water. How are you doing today, Genevieve?
I'm good. How are you?
Good. So, I'm going to write some mnemonics to help me
Okay.
go through this. Okay.
Okay.
Alrighty. So, to start with, do you have any pertinent past or current medical history?
Not really. I just get like heart palpitations occasionally, but that's it.
How long have you had it?
Couple of years, but it doesn't really bother me. I'm not taking any medication for it or anything.
Okay, good. Are you up to date on your immunization?
Yes.
Alrighty. And then, what do you do for health maintenance?
I mean, I walk my dog, I eat healthy, and I exercise.
Okay, very nice. So next, do you have any like allergies, starting with like any seasonal allergies or any food allergies?
No seasonal. For food, I guess caffeine.
Caffeine? What kind of reaction do you get?
Just heart palpitations, or I just feel nauseous.
Okay. Do you have any medication allergies?
No.
Good. All right. Next, do you have any surgical history in the past?
I had my wisdom teeth out when I was 16, but that's it.
All right. Have you had any like bone fractures or blood transfusion?
No.
Have you ever been hospitalized in the past?
No.
Do you have any pertinent family history, starting with your mom, mother?
She's GERD, but that's it.
Reflux?
Yeah.
Alright. And what about your father? Does he have any?
Hypertension and high cholesterol.
Alrighty. And then what about the grandparents of your mother's side? Do they have any pertinent?
My mom is adopted, so I don't know.
Okay. What about your father's side?
My grandpa on his side, I don't know, and my grandma, she has like CHF, heart problems.
Okay. Do you have any siblings?
No, I'm an only child.
Do you have any children?
No.
Do you take any prescription medications?
I take spironolactone, 100 milligrams daily for my skin.
Okay.
And that's all. That's the only prescription I take.
Alright. What about over-the-counter medications?
Occasionally like an ibuprofen if I get a headache, but that's rare. And I would
So
only take like 1 or 2 pills.
So, 200 to 400?
Yeah.
Do you get headaches often?
No, when I'm stressed.
Okay. Do you take any like vitamins or any essential oils?
I take like vitamin C or just like a multivitamin occasionally.
Okay. What about any herbs?
No.
Alright, next we're gonna move to your social history. So starting with your daily food intake, can you tell me what do you usually have for like breakfast?
I don't really eat breakfast, but lunch is my big meal, and I have like tofu or chicken, veggies, and rice usually.
Okay. What about dinner?
Dinner is usually small, like a smoothie.
Very nice. And do you exercise?
Yeah, I go like 2 to 3 times a week.
Alright, and how long do you usually work out for?
Like 45 minutes.
And what kind of exercise do you do?
Cardio and weightlifting.
Okay, and then do you take any illicit drugs?
No.
Do you smoke any tobacco?
No.
What about vape and chew?
No, no tobacco.
How many alcoholic drinks do you have per week?
I really don't drink, so no.
Okay. Do you drink any caffeine?
No, because it makes me sick.
Okay. How many glasses of water do you have per day?
I always have 1 liter to 2 liters of water. I drink a lot.
Okay. What do you do for a living, Genevieve?
I'm a student and a nurse.
Okay. And then I'm gonna ask you about safety. So do you wear seatbelt when you drive?
Yeah.
Do you text and drive?
No.
How many tickets have you had in the past year?
None.
Do you have guns in your home?
No.
Do you wear sunscreen when you go outside?
Usually.
Okay. Are you married?
Yeah.
Were you in the military?
No.
Do you have advanced directive?
No.
Do you have any religious preference?
No, not religious.
Alrighty. So we're done with the history part.
Okay.
So next we're gonna go to the review of symptoms. So
Okay.
starting with your general. Have you had any fatigue, malaise, body ache, sleep changes?
No.
What about appetite changes?
No.
Lately? No.
No.
Have you noticed any like skin discoloration?
No.
Do you get frequent skin infection? Do you notice any dry skin, itchiness, redness, any discharges coming from your skin,
No.
mold changes,
No.
hair changes?
No.
Have you had any like headache or trauma to the head?
No.
Yeah. Or any concussion?
No.
Have you noticed any like? Have you been having eye discharge, eye pain?
No.
Like what about like blurry vision, vision changes?
No.
When was your last eye exam?
Years ago. I don't remember.
Alright. When was your last hearing exam?
I don't remember that either. It's been forever.
Alright, and have you noticed any like ear pain, aching, discharge coming from your ear?
No.
Any hearing changes in general?
No.
Have you noticed any? Have you had any recently runny nose, stuffy nose, sneezing, snoring, like frequent sinus infection?
No.
When was your last dental exam?
A couple years ago.
Alright. Do you brush your teeth regularly or floss regularly?
Yeah.
Alright. Have you noticed any like gum pain, teeth pain, tongue pain recently?
No.
Any dry mouth?
No.
Any sore throat?
No.
Anything like that?
No.
And then next is your neck. Have you noticed any like lumps or masses in your neck anywhere?
No.
Any whiplash or trauma in your neck? What about your the breast area? Have you noticed any like discharges coming from your nipple?
No.
Or any like skin changes, hair changes? Any like infection? Any redness you notice around your chest area?
No.
Alright. You say you never had any blood transfusion, correct?
Correct.
Have you noticed any like unusual bruising or bleeding recently?
No.
What about any low blood iron?
No.
Alright, do you have difficulty with breathing during activity or at rest?
No.
What about shortness of breath,
No.
wheezing,
No.
new productive cough,
No.
coughing up blood?
No.
Have you had any like chest x-ray?
No.
Do you get frequent lung infections?
Never had one.
Have you ever had any history of heart problems?
Just the palpitations.
Palpitation? What about irregular heartbeat?
No.
Like hypertension?
No.
High cholesterol?
No.
Notice any edema? Like any like swelling in your legs? Any like paleness or blueness in your fingers or your toes?
No.
Any chest pain?
No.
Have you noticed any like difficulty swallowing recently? Any appetite changes?
No.
Any like nausea, vomiting, bloatedness?
No.
Like unusual flatulence?
No.
Any hemorrhoids? Bloody stool? Or tarry stools?
No.
Have you ever had any colonoscopy
No.
in the past? Do you get reflux problems?
No, not really.
Okay. Do you have any problem with your urination, such as like painful urination or burning with urination?
No.
What about incontinence,
No.
consistency,
No.
frequency? Do you get frequent UTIs?
I've only had one in my life.
When was your last menstrual period?
I don't really get them anymore because I have an IUD.
IUD? Okay.
Yeah.
When you used to have your menstruation, do you get like irregularities, such as like it's not consistently happening every month?
No, I always had good periods. They were regular, no cramping.
Okay, well, yeah. So no like heavy cramping. What about
No.
heavy flow?
No, it was always pretty light.
All right. Do you have any children?
No.
Are you sexually active
Yes.
with men or women or both?
Men.
And do you use protection?
Yeah, I'm married, so I don't really have to.
Okay. Have you ever had any like STDs or STIs?
No.
Have you noticed any like unusual changes in your like genital area, such as discharges or any pain,
No.
masses or lumps?
No, no issues.
Have you noticed any like excessive sweating, excessive hunger, excessive thirst?
No.
Or about excessive need for urination?
No.
Or about sweating, excessive sweating?
No.
What is that?
Mm-mm.
Heat and cold tolerance?
No.
And then have you noticed any like leg cramps or varicosities in your legs?
No.
What about any problem with like clottings or thrombi?
No.
Do you have any joint or muscle pain or stiffness?
No.
What about gout,
No.
arthritis, back
No.
problem?
No.
Have you recently had any like dizziness or headache,
No.
memory loss, speech problem,
No.
gait changes,
No.
seizures,
No.
tremors,
No.
tics,
No.
any numbness and tingling anywhere in your extremities?
No.
Any loss of consciousness?
No.
Have you ever been physically, emotionally, or sexually abused in the
No.
past? Any history of violence?
No.
Do you currently have any like depression or anxiety? Have you ever had any suicidal thoughts? Have you noticed any like unusual mood changes
No.
or inability to cope with stress?
No.
Okay. And that concludes our review of symptoms.
Okay.
Symptoms. So next thing I'm gonna do is I'm gonna do the physical part.
Okay.
So can you please move forward a little more? Good. And then just like based on your general appearance, patient is alert. Based on the conversation, patient is alert and rated ×4. And also based on the general appearance, patient is in no apparent distress. He is well nourished and good hygiene. So next, I'm gonna inspect for your head, and
Okay.
then the eyes are located appropriately. Ears, nose, and mouth are also symmetrical. And I'm gonna inspect the hair and palpate the hair and scalp. Scalp has good mobility. The hair is smooth and nice and smooth. There's no masses or any abnormalities noted there. And then the next thing I'm gonna check for your temporal arteries. So temporal arteries are 2+, they're equal bilaterally. And then next I'm gonna check for cranial nerve number 7, which is facial. And I'm gonna have you make some faces for me. Can you please puff up your cheek? Can you please smile for me? Can you please lift your eyebrows and then look surprised for me? Good. And then next I'm gonna check cranial nerve number 5, which is trigeminal, the motor part to be precise. I'm gonna put my hands here. And then can you please like clench your jaw for me? And then can you please open your jaw? So that cranial nerve is intact. So, and then the next thing I'm gonna do is that I'm going to check the cranial nerve number 5 still, the trigeminal, but I'm gonna do the sensation part. So can you please close your eyes for me? Now let me know when you start feeling the cut.
Okay. Yep. 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 Yep.
So that cranial nerve is intact as well. So next thing I'm gonna do is that I'm just gonna inspect your palpebral folds, your globe, and then your lacrimal patterns. There's no abnormalities noted there. They're symmetrical and they're equal bilaterally. And then next, I'm gonna inspect your eyelids, eyebrows, and eyelashes, and they are equally dispersed. They're symmetrical, no abnormalities noted. And then I'm gonna inspect your sclera. Sclera is white and there's no injection. The iris is blue, they're round. As well as the pupil, cornea is clear, there's no thickness noted. And then next I'm gonna inspect your conjunctiva, and then I'm gonna just like pull your eyelids down, okay?
Okay.
So conjunctiva is nice and thick and moist, same in the upper part. So and the next thing we're gonna do, I'm gonna check for cranial number 2, which is the optic. I'm gonna test your peripheral vision, okay?
Okay.
So can you please tell me when you see my hands?
Yeah. No.
Okay, good. So, and then the next thing I'm gonna do is I'm gonna check for cranial nerve 3, 4, and 6, which is abducens. Oculomotor trochlear and obtusans. Okay, can you please look at my finger, and then follow my finger as I move it only with your eyes. Okay. There's no nystagmus noted there, and then those cranial nerves are intact as well. So next thing I'm gonna do is I'm gonna check for cranial nerve 2 and 3, which is optic and ocular motor. I'm gonna have to check for accommodation. Normally I would dim the light, but since this is daylight, there's no need for that. So can you please look at my finger? And can you please follow my finger? Alright, and then still look at my finger and then look at me. And look at my finger again. Perfect. And then next I'm gonna check for your pupillary reaction to light. So starting with the right eye. Shyness in the bridge of your nose. So light falls in the same position in both eyes, and pupils are reactive to light. And then next thing I'm gonna do is I'm gonna use the ophthalmoscope to look into your eyes, okay? So I'm gonna stabilize the patient's head. Now look into your eyes. It's gonna feel a little bright. Okay, let me know if it's starting to get a little uncomfortable.
Okay.
Alright. Let's do the other one. The optic disc is nice and clear, there's no abnormalities noted. The macula is also visible, there's no abnormalities noted there. And then the AV ratio is 2 to 3, which is normal. Alrighty, so next I'm going to do is that I'm going to just inspect your ear in general from the outside, and I'm going to palpate it as well. Any pain as I was doing this? So ear symmetrical, there's no masses or redness noted. Now I'm going to do a couple of tests, starting with the whisper test. So can you please cover one of your ear for me, and then repeat what I whisper to you, okay? Chair.
Chair.
Do the same thing with the other ear. Orange.
Orange.
Very nice. So the cranial nerve number 8 is intact, which is the acoustic. So, and then next I'm going to check for the Weber and Riley test, starting with the Weber test. I'm gonna put this in your forehead. Let me know if you hear it both equally in both ears, okay?
Yeah, it's equal.
Okay, and then I'm gonna do the same thing, but I'm gonna put it in the back of your ear, and then let me know when you stop hearing it. And after that, I'm gonna move it to in front of your ear. Let me know when you stop hearing it, okay?
Okay. No. No.
All right.
No.
Okay.
No.
All right. So air and bone conductions are equal in both ears. Air is longer than bone conduction, which is normal. So the next thing I'm going to do is that I'm going to look into the inside of your ears,
Okay.
to your auditory canals, and I'm also going to inspect your tympanic membrane, okay?
Okay.
So I'm going to stabilize the patient's head and hold it, and then let that ear up a little. So there's no erythema noted, there's no cerumen noted, the tympanic membrane is patent, there's no masses or lesions noted, and then the cone of light on the tympanic membrane is at 7 o'clock. Same thing here. So no cerumen or redness in the auditory canal, and then the tympanic membrane is clear, and the cone of light falls at 5 o'clock, and it is also patent. Okay, so Next thing I'm gonna do is that I'm gonna inspect your nose from the outside. It is symmetrical, it is midline, there's no abnormalities noted there. And then I'm gonna look at the inside of your nose using the otoscope. I'm gonna stabilize the patient's head. Right. Same thing here. The other nostril. So there's no redness, there's no masses, lesions noted inside the nose. The turbinates are patent and there's no deviation in the septum. So next I'm going to palpate for your sinuses, so starting with the maxillary sinuses. Is there any tenderness there?
No.
Then the frontal sinuses, any tenderness there?
No.
There's no masses or lesions, there's no masses noted there. And then I'm just gonna inspect the outside of your mouth right now. Also, there's no abnormalities noted. Can you please smile for me? I want to see your teeth. There's no decay. There's no cavities noted in the teeth. They look to be in good hygiene. There's no cavities or any dental stuff. So and then I'm gonna look at the inside of your mouth. The buccal mucosa is nice, pink and moist. There's no sores noted. And then, can you please stick out your tongue for me? And can you please stick out your tongue? Say ah. So that's checking for the cranial nerve number 9, which is glossopharyngeal. I was checking for the gag reflex, and the uvular rises indicating good gag reflex, so the cranial nerve is intact. So, the next thing I'm gonna do is that I'm gonna check for cranial nerve number 10 and 12, which is vagus and hypoglossal. Can you please stick out your tongue? Then can you please lift your tongue up and down, left to right. So that's checking, so those cranial nerves are intact and it's checking for tongue location and then mobility. So those are good. Then next thing I'm gonna do is that I'm gonna check for your lymph nodes, okay? Starting with the pre-auricular lymph nodes. There's no masses. Let me know if you feel any pain as I'm doing this. And then the post-auricular lymph nodes, there's no masses there. Temporal lymph nodes. Occipital lymph nodes, occipital lymph nodes, and then posterior cervical lymph nodes, and then tonsillar, submaxillary, submantle, deep cervical, anterior cervical, supraclavicular, and infraclavicular. There's no masses or nodules noted there. And then next thing I'm gonna do is I'm just gonna look at your neck and inspect your neck. It seems to be midline. The trachea is midline as well. There's no abnormalities noted there. There's no like jugular distension or anything like that. So I'm gonna palpate for your artery, the carotid artery. So 2+ for the left one, and then 2+ for the right one as well. And then next thing I'm gonna do is I'm gonna check for your thyroid. Can you please take a sip of water from me and then hold it in your mouth? Okay, when I tell you to swallow, can you please swallow for me?
Mm-hmm.
Swallow. Good. And then do the same thing. Can you please swallow for me? So thyroid is nice. It is not enlarged. There is no it is rounded. There's no nodules noted. So next thing I'm gonna do, I'm gonna inspect your anterior chest. So palpating as well. Any pain as I'm doing this?
No.
There's no masses or no nodules noted. There's no lesions as well. There's no redness. The chest falls and rises symmetrically, and then breathing is without any effort. So the next thing we're gonna do is I'm gonna auscultate for your carotid artery first, and then to your auscultate your heart. Okay.
Okay.
I'm gonna use the bell for the carotid artery. Checking for bruit. There's no bruit hurt there. Same here. So next I'm gonna listen to your heart. Starting with the diaphragm first, I'm going to listen to 5 locations for your heart, starting with the aortic area. So aortic, pulmonic, tricuspid, and then mitral. Then now I'm going to listen with the bell, aortic, pulmonic, herb, tricuspid, and then mitral. Now I'm going to listen to the mitral area for approximately 1 minute. Alrighty. So heart rate is regular as 1 and S2 heart sounds is heard. There is no extra heart sounds. There's no murmurs noted as well, and the heart rate is approximately 70 beats per minute. Alright, and then next I'm going to inspect your back. So can you please just turn to your side like that? Perfect. So I'm inspecting the back. The scapula and shoulder are symmetrical. They are also appropriately located. There's no skin abnormalities noted. There's no masses upon palpation. There's no nodules as well. And the chest rises and falls symmetrically. The AP diameter and lateral diameter is also appropriate. So next thing we're gonna do is that I'm gonna check for textile fragments. So when I put my hand on your back, can you please say 99 for me?
99, 99, 99.
Very nice. And then the next thing we're gonna do is I'm gonna percuss your back. So it's nice and dull. And then I'm gonna check for CVA tenderness. I'm gonna give you any pain.
No. No.
Good. And then next I'm gonna auscultate your lung sounds.
Okay.
So when I put my stethoscope on your back, can you please take a normal breath for me?
Yeah.
So brachial sound is heard there, and then towards the middle you hear the tracheal sound. Here you hear the bronchiovesicular sound. And then as you go lower, you start hearing only the vesicular sound. Very nice. So lung sounds are clear. There's no adventitious sounds noted. Can you please turn into your front for me again? Perfect. So next thing we're just going to inspect for your upper extremities. It seems to be symmetrical. There's no abnormalities noted. The head of humerus is normal, and then the SC joint and the AC joint is appropriately located. So I'm gonna check for your skin warmth. Skin is nice and warm. There's no masses and nodules noted. Has good skin texture. And then next, I'm gonna check for capillary fill. Less than 3 seconds. There's no abnormalities noted there. Can you please spread your fingers for me? That's abduction of the fingers. And then I'm going to check for your strength. So can you please resist me? So good finger strength, 5 out of 5 strength. So the next thing I'm going to do is I'm going to check for your range of motion of your wrist. Okay?
Okay.
Can you please go like this? And then put your wrist down for plantar flexion. And then put your wrist up for dorsal flexion. And then can you please point toward like this? That's for radial deviation. And then out like this for radial ulnar deviation. Yeah, for ulnar deviation. So range, full range of motion of the wrist. And then next thing I'm going to do is that put your hands like that on your hip, and then on your thighs. And then can you please like very rapidly like move it up and down like that? Perfect. So that's checking for the rapid hand movement. Also, this is the rapid hand movement as well. Can you please repeat what I'm doing? Touch your fingers to your thumb rapidly. Good. So rapid hand movement is in check. The next thing I'm going to do is that I'm going to check for the tinea and phalanx test. So can you please go like this? This is the phalanx test, checking for carpal tunnel. Do you feel any numbness and tingling there? No? Good. And then next for the tinea test, any numbness and tingling, so you're doing that? Over here? So negative for both tests. And then next thing we're gonna do is I'm gonna check for your strength, okay? So squeeze my fingers, good. And then can you please make a palm? And then resist me as I'm trying to push and pull, okay? So good muscle strength for the biceps and triceps, 5 out of 5 strength. So next I'm gonna do is I'm gonna do a passive range of motion of the shoulders. Any pain as I'm doing that?
No.
Good. Same thing here. No crampiness noted, no pain noted. And the next thing I'm going to do is that, can you please scooch forward a little? And then I'm going to do an active range of motion on the shoulders. Can you please lift your shoulder up like that? And that's checking for flexion. Then back like that, that's extension of the shoulders. Then can you please cross your arms like this? Good, that's internal rotation. And then can you please go like that? That's external rotation of the shoulders. And then can you please lift your hands up like that? That's abduction of shoulders. And then cross your hands like this, that's adduction. So full range of motion of the shoulders as well. And next I'm going to inspect for your epitrochlear lymph nodes. And then any pain as I'm doing this? There's no masses or nodules noted there as well. So next thing I'm going to do is I'm going to check for your reflexes, okay? Starting with the brachioradialis reflex. Relax. Okay. So 1 plus equal bilaterally. Then next the biceps reflex. 1 plus equal bilaterally. And for the triceps reflex, relax. So 2 plus equal bilaterally for tricep reflexes. Alrighty, so now can you please lay down for me? So again, I'm gonna listen to your heart.
Okay.
Starting using the diaphragm. So aortic area, pulmonic, herbs, tricuspid, mitral. Now next I'm going to do with the bell, the aortic area, pulmonic, herbs, tricuspid, and then mitral. And can you please move to your side for me? Perfect. I'll help you out. All right, perfect. So I'm going to listen to your point of maximum impact here in your heart for 5 seconds. Good. Can you please lean back, turn? All right. So S1 and S2 sounds heard as well. There's no extra sounds. There's no murmurs noted. And next I'm going to inspect your abdomen, okay? Alright, upon inspection, the umbilicus is midline. Abdomen is nice and flat. There's no abnormalities noted. There's no skin discoloration or anything like that. Can you please cuff for me? There's no bulging upon cuffing. Next, I'm going to auscultate your abdomen, okay? First, it's in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So bowel sounds is normal, active. And the next I'm going to check for friction rub in your liver first. And then spleen, there's no friction rub heard. And next I'm going to auscultate for your arteries, starting with the aortic artery, checking for bruit, there's no bruit there. Then renal arteries. And then in iliac arteries, there's no bruits heard. So next thing we're gonna do is I'm gonna do percussion. So percussing the abdominal area is nice and tympanic, and then I'm gonna percuss for your liver, okay?
Okay.
Liver is located 1 to 2 centimeters below the right intercostal margin. And I'm going to try to percuss for your spleen. So spleen is not percussible. So next I'm gonna just do like a live palpation. Let me know if you feel any tenderness here.
No.
Good. And I'm gonna check for your inguinal lymph nodes.
Okay.
Any pain here?
No.
I'm gonna check for your femoral lymph nodes. There's no masses there either. I'm gonna check for your femoral pulse. Yeah, 2 plus equal bilaterally. Alright. And then next thing I'm gonna do is I'm gonna do like a deeper palpation, okay?
Okay.
Let me know if you got any pain. So I'm gonna go 2 centimeter deep in approximately. Good. And then next I'm gonna palpate for your liver. Can you please take a deep breath for me? Then release. Good. Liver is not enlarged. And then same thing with your spleen. Take a deep breath. Release. Spleen is not palpable. I'm gonna try to palpate for your kidneys. They're not palpable either. So the next I'm gonna do like 4 tests approximately. First one is the rebound tenderness test, checking for any pain as I'm releasing like this. Any pain?
No.
Next I'm gonna check for the Murphy's test. I'm gonna hook my fingers into your right rib cage. Let me. Can you please take a deep breath for me and release? Any pain as you're doing that?
No.
So that's negative for the Murphy sign. And then next I'm gonna check for the iliopsoas sign. So bend your knee and then can you please try to bring your knees up to your chest? Any pain in your abdominal area as you're doing that? No, good. And check. Next I'm gonna check for the obturator sign. Any pain as you're doing this?
No.
Good. So those tests are all negative. So next I'm gonna do is I'm just gonna inspect your lower extremities, okay?
Okay.
Just gonna palpate it. There's no abnormalities noted. There's no edema. There's no cyanosis upon inspection. Some minor bruising. Any pain as I was doing this to your ankle?
No.
What about to your knee? Any pain as I'm moving your knees?
No.
All right, good. Now I'm gonna check for a pre-tibial edema. Checking for 5 seconds. There's no edema there. And then next I'm gonna check for the popliteal pulses.
Okay.
There's about 1 plus equal bilaterally, and then your post-tibial pulses. 1 plus equal bilaterally, and then your PO pulses. 1 plus equal bilaterally. So the skin is nice and warm. There's no masses. There's no redness lesions noted there. So the next thing we're gonna do is that I'm gonna check for your range of motion. Okay. First on your ankles. So can you please point your feet down towards the ground? That's plantar flexion, and then can you please point your toes up into the ceilings? That's dorsiflexion. And can you try to like bring your soles to face one another like that? That's inversion. And then away from one another. That's eversion. So full range of motion of the ankles. And next I'm going to do a range of motion of your knee. So this is a flexion of the knee. And then this is the extension of the knee. And I'm going to do a straight leg raise test. Straight leg raise test as I'm doing this. Okay? Let me know if you start feeling any pain. Any pain?
No.
Good. And the same thing here. Flexion of the knee. Extension of the knee. And then straight leg raise. Any pain? Good. And next I'm going to check for the range of motion of the hip. So the knee has full range of motion. Next I'm going to check for the range of motion of the hip. Can you please spread your hips apart like that? That's abduction. And then can you please bring it back together? That's adduction. And then next can you, I'm going to do like internal rotation of the hip. External rotation of the hip. The same thing here. Internal rotation of the hip. External rotation of the hip. So full range of motion of the hip. And then can you please try to sit up for me? That's checking for the trunk strength. And then next I'm gonna check for your lower extremity strength, okay?
Okay.
Can you please push down on my hands with your feet? Push up. So and then can you please try to resist me? So try to push your legs in and then pull your legs out. So those are good muscle strength, so 5 out of 5 strength. And next I'm gonna check for your tendon reflexes starting with the patellar.
Okay.
Can you please relax for me? Good. So 2 plus equal bilaterally for the patellar reflexes, and then for the Achilles reflexes, can you please relax? So about 1 plus equal bilaterally for the Achilles reflexes. So next I'm gonna help you stand up, okay? Good. So just inspect your back right now. So upon inspection, the spine is midline. It is symmetrical. It is S-curve. There's no abnormalities noted there. Hips is also symmetrical. And I'm gonna put my hands on your hips. Can you please try to bend and then try to reach your toes? Good. And then bend backwards on your spine and your back like that. Perfect. And can you please twist side to side? Good. And then can you please lean side to side? Good. So full range of motion of the spine. And next, can you please face forward? Face me. Then can you please lift your hands up like that. Close your eyes. Then can you please try to like touch your nose with your fingers one at a time? Good. Perfect. Still close your eyes. Gonna check for the Romberg test. So, good. And then next thing I'll do, can you please open your eyes? Now I'm gonna have you raise one of your leg up. Good. And then do the other one. Perfect. Good balance. And then next, can you please walk towards me, checking for your gait. Gait is normal. And then can you please walk toward me, but one heel to toe. Perfect. So that concludes our physical examination. Thank you very much.
Thank you.
I appreciate it. Have a good day.
You too.